Dear students, the main objectives are to know about the basic concepts of genetic counseling and their types, to understand the role of genetic counselor in advising the risked family, to explain the different components in the genetic counseling procedure, to know about the pedigree analysis and psychotherapeutic counseling, to clarify about the indications and the risk assessment of genetic counseling. Introduction. Genetic counseling is the process of advising or helping the parents or families about the medical, reproductive, psychological and social implications of the genetic conditions. The genetic counselor needs to be obedient about the information giving about the genetic diseases. They have the responsibility to handle every situation in a controlled manner. The advice should not hurt the parents and it should be conveyed in an understanding procedure. Hence, this episode is further explained in the following subtitles. A. Genetic counseling and types. B. Indication for the genetic counseling. C. Components in the genetic counseling practice. D. Pedigree analysis and the psychotherapeutic genetic counseling. E. Risk assessment of genetic disorders in genetic counseling. The American Society of Human Genetics in 1975 adopted the following definition of genetic counseling. I quote, "Genetic counseling is a communication process which deals with the human problems associated with the occurrence or the risk of an occurrence of a genetic disorder in the family. This process involves an attempt by one or more appropriately trained persons to help the individual or family to comprehend the genetic facts, including the diagnosis, probable course of the disorder, and the available managements, appreciate the way heredity contributes to the disorder, and the risk of recurrence in specified relatives, understand the alternative for dealing with the risk of occurrence, the course of action which seems to them appropriate in view of their risk, their family goals and their ethical and religious standards to act per that decision, and to make the best possible adjustment to that disorder in an affected family member and the risk of recurrence of that disorder." Unquote. Mainly, it attempts to diagnose the particular genetic condition accurately and assess the risk of occurrence of that genetic condition in a concerned family or relatives. It also tries to provide alternative method for couples who have a higher risk of having a baby with a genetic disorder. It contains all the information regarding the particular genetic condition and the inheritance pattern by analyzing the pedigree. Genetic counseling makes individual think and make decisions. For every decision, of the individual, the genetic counselor will support and educate them with many possibilities. It provides support for the family members to cope with the recurrence of the genetic disorder. People who provide information about the particular genetic disorders and the risk assessment are called as genetic counselor. Genetic counselors work with individuals who are concerned about the risk of having genetic disorders. The counselors cannot prevent the chances of having genetic conditions, or they cannot make the decision for the family with genetic disorders. They can mainly help and guide the members of the family who assess the risk of genetic diseases. Some family may have a history for a particular genetic disorder or other problems like infertility, miscarriages and stillbirth. Then couples will be worried about having a baby with a history of many genetic problems. They mainly seek the help of a genetic counselor. The main work of genetic counseling is to carefully examine the cases of genetic disorders by evaluating the family history and other reports of medical history. By assessing the history of occurrence of genetic diseases, the genetic tests are conducted. Genetic tests are done usually by collecting the blood or tissue samples from the couple. By analyzing through different tests, it is possible to determine that the person carrying the genes for inherited disorders. By seeking that information from the genetic test results is investigated. The main task of the genetic counselor is to understand the necessary knowledge, consequences and the risk of particular genetic conditions to the parents. By this way, they may help the parents to make the decision about plans. There are two types of genetic counseling. They are prospective genetic counseling and retrospective genetic counseling. Prospective genetic counseling can be done before the occurrence of a genetic condition. If an individual is subjected to genetic test or screening and finds out that he or she is heterozygous for the genetic condition, then they have the possibility of having a baby with a genetic disease if they marry a person who is also heterozygous for the same genetic condition. In that case, the genetic counseling helps to advise the individual about the risk of having genetic diseases in a family. Retrospective genetic counseling is done for the family which already possesses the cases of genetic diseases. At present, most of the genetic counseling is retrospective. Many instances of the family are with congenital problems and mental retardations. Only a few cases a couple seek advice before getting married. Indications for the genetic counseling shows that the people who are expecting or suffering from various conditions of genetic abnormalities Some of them are as follows. A. Maternal and paternal age. Individuals who are at an older age have a higher risk of having birth to a child with genetic defects. The woman at 35 or more than 35 years of age get pregnant, and the prenatal diagnosis of that woman shows chromosomal abnormalities or other genetic abnormalities. The advanced age of man also result in the defects. Hence, advanced maternal and paternal ages are one of the common indications for genetic counseling. B. Exposure to chemicals. Exposure to the higher concentration of chemicals, temperature and radiation will damage the genetic material. It can easily create genetic abnormalities by causing mutations in the genome. Some of the lifestyles and food can also be the reason to get into higher risk. These people are concerned about having the abnormalities. C. Family history of genetic disorders. Some people already have an account of genetic disorders in the family. They are concerned about having a baby when they have a family history of genetic diseases. Family members, parents or relatives may suffer from particular genetic disorders. The couple may concern if they carry the affected gene for the same genetic condition. A genetic diagnosis may show some of the results of anomalies. D. Fetal abnormality conditions. Parents may not suffer from any genetic disorders and the baby may get the abnormalities. Prenatal diagnosis of a pregnant woman will help to find out the abnormal condition of the unborn baby. E. Loss of pregnancies. In some cases, a woman may suffer from a loss of 2 or more pregnancies. It is also a risk factor for further pregnancy. It is essential to diagnose or carry out genetic tests to examine genetic conditions or other conditions. F. Case of consanguineous marriage. The occurrence of abnormalities in the next generation is higher in case of a consanguineous marriage, that is a marriage of blood relatives. They may worry about having a baby. Genetic counseling involves many parts for advice. They are as follows. A. Occurrence assessment of the condition. The particular case of genetic diseases are analyzed by conducting the various screenings and diagnostic tests. The information will help to investigate the chances of occurrence of a specific condition in the family. Genetic disorders can inherit a dominant or recessive disease. The defected gene may present in autosomes or sex chromosome. B. Providing basic information about the inheritance patterns. After establishing the genetic conditions through various genetic tests or diagnosis, individuals are provided with basic knowledge of inheritance patterns of genetic disorders. The information can also be given before the genetic tests about the possible testing options management and prevention methods. See, giving information or education. The patients and family should be educated about their diagnosis, working of diagnosis for different genetic disorders, the concept of genetic risk and their assessment, history of the genetic condition, inheritance patterns, recurrence risk and risk for the other family members or relatives. D. Giving psychological support or counseling. People may get fear or anxiety after knowing the situation. In those cases, the genetic counselor will help them to provide mental support and advice to reduce the risk of having genetic diseases for further generations. The psychological supports will help the client to think positive about the situations and bring hopes about managing the risk. They will be provided with time to think and choose for the further step. E. Skills to interpret the research results. Genetic counselor should be master level of a counselor. MD genetist or PhD genetist who can interpret the research findings. Having much knowledge about the basic genetics and inheritance disorders, screening and diagnosis, help them to convert the results into basic information which will help the client. Pedigree analysis. To conduct genetic assessment and to verify the particular genetic conditions of the family history, medical history and various pathological history, genetic examinations are essential. Pedigree analysis is essential to conduct and analyze the inheritance patterns. The common information about genetic disorders can be obtained by constructing 3 or 4 generation pedigree. By the help of pedigree analysis, it is easy to find out the congenital abnormalities like deafness, heart defects and cleft palate. Chronic conditions like lung infections, other problems including stillbirths, miscarriages, infertility and developmental issues can also be examined. Pedigree analysis plays an essential role in genetic counseling. By conducting the pedigree analysis, it helps further to diagnose the genetic diseases. The patterns of inheritance of particular trait help the counselor to advise the possibilities, risk of occurrence of disease in the next generation. By this way, it can determine the risk of having a child with a genetic disorder. The pedigree can show the family members, relatives and also it can include the information like date of birth, age of death, reasons for the death and other related health problems with the date of genetic test. The medical reports of other relatives who are affected are also used to ensure medical information. Care should be taken before revealing the data from pedigree analysis. After the pedigree analysis is carried out, the possibilities of having genetic disorders in a family or other relatives are determined. Relatives may advise taking some of the genetic tests. Genetic tests include the karyotyping, urine test, blood test, skin biopsy and ultrasound scanning, etc. All the information is collected from various genetic tests. Genetic counselor, by using that information, can find out the risk of having genetic disorders. Psychotherapeutic genetic counseling. It is not possible to accept the conditions by the people when they are set that they have the risk of having genetic disorders. People may become mentally ill or have some of the psychological problems like pretending that they are sick person, insecurity about the health and fear about future consequences. Some pregnant woman may get disturbed or get anxiety for the child being ill, emotional imbalances and fear for their health. In some severe genetic disorders, parents may make decision for the termination of pregnancy which they may find as the murder of an unborn baby, or woman may get into depression for the loss of a baby. A lot of anxiety, emotions and criticism can run through in mind, which can disturb the mental health of the individual. For these conditions, counseling method is conducted to help the person by the psychotherapeutic counseling. Some of the psychological procedure include healthy interaction with the client, supporting their decision and helping them to overcome their problems in a controlled way. It is considered as the healthy connection between the client and the counselor. A counselor or the therapist makes the client to feel in an accepted, uncriticized, non-judgmental and not directive way. The genetic counselor serves as patient advocates and serves as educator and as a resource for other healthcare professionals and general public. Psychotherapeutic counseling mainly helps in improving the client's mental health and the well-being to enhance the social relationships and skills, healthy thoughts and to suppress the scary thoughts, emotions and superficial beliefs. Some people are taken under counseling based on mental disorders. Hence, genetic counseling faces many challenges in convincing and educating the people with all emotional, medical and psychological consequences of genetic disorders. Risk assessment is the method of assessment of the risk of an individual for having specific mutation in genetic makeup, particular disorders or the risk of having a baby with specific genetic diseases. Evaluation of the risk of an individual can say about the chances of getting genetic disorders. Risk assessment can be done mathematically or statistically using models which include the components like medical history and other informative backgrounds. By this method, it is possible to identify the possibilities of individual possessing a specific gene mutation or showing the particular genetic disorder trait. By conducting various genetic testing, the risk factor and their frequency can be determined. The genetic test can be done for parents, siblings or relatives. All the background information is obtained in the calculation of genetic risk. The assessment of risk can be done based on the genetic testing or diagnosis for the disorder. The evaluation of risk for the relatives can be done because they also have a higher risk for genetic disorders which can be determined earlier. Prenatal diagnosis can be performed to determine the risk of having a baby with a genetic condition. The evaluations are done to predict the occurrence of genetic mutations. The presentation of the risk should not simply involve conveying start risk figures in isolation, but parents must be given as much background as possible. As a rule of thumb, the recurrence risk should be quantified, qualified and placed in context. In the case of Mendelian disorders, the patterns of inheritance and the risk of having affected children can be examined. Dominant diseases are usually caused by more specific mutation, which are generally easier to identify and follow across a pedigree. In this case, mutations occur specifically and they can be identified in each generation. For autosomal recessive diseases, the carrier frequency in the general population is small. The carrier's risk decreases by half at each steps across a pedigree from the affected family member to a given individual. In X-linked recessive diseases, where the carrier's risk decreases by half at each step from one female member to another female member in the proceedings or successive generation of the pedigree. In straightforward counseling situation, little more than knowledge about the Mendelian inheritance is needed, because the problems are delayed age of onset, reduced penetrance and use of linked markers can make calculations more complex. There are several other problems in genetic counseling. They are adoption and genetic disorders, disputed paternity, genetic heterogeneity, phenotypic heterogeneity, non-paternity, sporadic cases, incomplete penetrance and variable expressivity. In conclusion, genetic counseling plays an important role in advising the family or individual about the risk of genetic disorders. The chances of occurrence of genetic diseases can be avoided by taking proper counseling. Thank you.